Welcome! Today, we're diving into the world of high blood pressure, also known as hypertension. This condition affects millions worldwide and is a leading risk factor for heart disease and stroke. But what exactly causes those numbers to rise? In this video, we'll explore the most common triggers for hypertension, helping you understand what to watch out for in your daily life. By recognizing these triggers, you can take proactive steps to manage your blood pressure and protect your long-term health. Let's start by understanding what hypertension really means and why it's so important to keep it under control. Blood pressure is the force of your blood pushing against the walls of your arteries as your heart pumps. It's measured in two numbers: systolic, the top number, and diastolic, the bottom number. When these numbers are consistently high, it's called hypertension. High blood pressure often has no symptoms, earning it the nickname, the silent killer. That's why it's crucial to know what can cause your blood pressure to spike, even if you feel perfectly fine. Next, let's look at the lifestyle factors that can lead to hypertension. One of the most significant triggers for high blood pressure is a diet high in salt. Sodium causes your body to retain water, which increases the volume of blood in your vessels and raises your blood pressure. Processed foods, canned soups, and restaurant meals are often loaded with hidden salt. Even if you don't add much salt to the table, you might still be consuming more than you realize. Reducing your sodium intake is one of the most effective ways to lower your blood pressure. Let's see what other dietary factors play a role. Carrying extra weight puts additional strain on your heart and blood vessels. Obesity is a well-known risk factor for hypertension. As your body mass increases, your heart has to work harder to pump blood throughout your body, which can lead to higher blood pressure. Even modest weight loss can make a significant difference in lowering your numbers. Maintaining a healthy weight through balanced eating and regular physical activity is key to preventing and managing high blood pressure. A sedentary lifestyle is another major trigger for high blood pressure. When you don't get enough physical activity, your heart and blood vessels become less efficient. Regular exercise helps keep your heart strong and your arteries flexible, which supports healthy blood pressure. Even simple activities like walking, cycling, or swimming can make a big difference. Aim for at least 30 minutes of moderate activity most days of the week to help keep your blood pressure in check. Drinking too much alcohol can raise your blood pressure. While moderate drinking might not have a significant effect, heavy or frequent drinking can cause your numbers to climb. Alcohol can also interfere with blood pressure medications and contribute to weight gain. If you choose to drink, do so in moderation generally. That's up to 1 drink per day for women and 2 for men. Let's move on to another common trigger: smoking. Smoking is a powerful trigger for high blood pressure. The chemicals in tobacco damage your blood vessels, making them narrower and less flexible. This forces your heart to work harder, raising your blood pressure. Even exposure to secondhand smoke can have harmful effects. Quitting smoking is one of the best things you can do for your heart and blood pressure. The benefits start almost immediately after you stop, so it's never too late to make a change. Stress is a part of life, but chronic or unmanaged stress can contribute to high blood pressure. When you're stressed, your body releases hormones that temporarily increase your blood pressure by causing your heart to beat faster and your blood vessels to narrow. Over time, this constant pressure can take a toll on your cardiovascular system. Finding healthy ways to manage stress, such as meditation, exercise, or talking with friends, can help keep your blood pressure in a healthy range. Not getting enough sleep can also trigger high blood pressure. During deep sleep, your blood pressure naturally drops. But if your sleep is frequently interrupted or you don't get enough hours, your body misses out on this important recovery time. Over time, poor sleep can contribute to hypertension and other health problems. Aim for 7 to 9 hours of quality sleep each night to support your heart health. Caffeine, found in coffee, tea, and many sodas, can cause a temporary spike in blood pressure. For some people, this effect is more pronounced, especially if they're sensitive to caffeine or consume large amounts. While moderate caffeine intake is generally safe for most people, it's wise to monitor how your body responds. If you notice your blood pressure rises after caffeine, consider cutting back or switching to decaf options. Your genes play a significant role in your risk for hypertension. If you have a family history of high blood pressure, you may be more likely to develop it yourself. While you can't change your genetics, being aware of your family history can help you take preventive steps early. Regular checkups and healthy lifestyle choices are especially important if hypertension runs in your family. As we age, our blood vessels naturally become stiffer and less elastic. This makes it harder for blood to flow smoothly, which can cause blood pressure to rise. Hypertension is more common in older adults, but it's not an inevitable part of aging. Staying active, eating well, and managing other risk factors can help keep your blood pressure in a healthy range as you get older. Your kidneys play a crucial role in regulating blood pressure by controlling fluid balance and filtering waste from your blood. Chronic kidney disease can disrupt this process, leading to higher blood pressure. Conversely, uncontrolled hypertension can also damage your kidneys, creating a dangerous cycle. Managing both conditions together is essential for protecting your overall health. People with diabetes are at higher risk for hypertension. High blood sugar can damage blood vessels and kidneys, making it harder to control blood pressure. Managing diabetes through medication, diet, and exercise is vital for keeping your blood pressure in check. Regular monitoring and working closely with your healthcare team can help you stay on top of both conditions. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. This disrupts your rest and causes drops in oxygen levels, which can trigger spikes in blood pressure. Many people with sleep apnea are unaware they have it. If you snore loudly or feel tired during the day, talk to your doctor. Treating sleep apnea can significantly improve your blood pressure and overall well-being. Some medications can raise your blood pressure as a side effect. These include certain pain relievers, decongestants, birth control pills, and some antidepressants. Always check with your doctor or pharmacist about the potential effects of any medication you take. If you notice your blood pressure rising after starting a new medicine, let your healthcare provider know right away. Hormonal imbalances, such as those caused by thyroid problems or adrenal gland disorders, can lead to high blood pressure. These conditions affect how your body regulates fluids and blood vessel tone. If you have symptoms like unexplained weight changes, fatigue, or unusual sweating, your doctor may check for hormonal causes of hypertension. Pregnancy can sometimes trigger high blood pressure, a condition known as gestational hypertension. This usually develops after 20 weeks and can pose risks to both mother and baby if not managed properly. Regular prenatal checkups are essential for monitoring blood pressure during pregnancy. If you develop high blood pressure while pregnant, your healthcare team will guide you on the safest treatment options. Some people are more sensitive to the effects of salt than others. If you're salt sensitive, even small increases in sodium intake can cause your blood pressure to rise. This sensitivity is more common in older adults, people with African ancestry, and those with certain medical conditions. If you suspect you're salt sensitive, talk to your doctor about the best dietary approach for you. Not drinking enough water can also affect your blood pressure. When you're dehydrated, your blood volume decreases and your body releases hormones to retain water and constrict blood vessels, which can raise your blood pressure. Staying well hydrated is a simple but important way to support healthy blood pressure levels. Acute or chronic pain can cause temporary spikes in blood pressure. When you're in pain, your body releases stress hormones that make your heart beat faster and your blood vessels narrow. Managing pain through medication, therapy, or relaxation techniques can help prevent these spikes and support overall cardiovascular health. Many people don't realize that common over-the-counter remedies, like cold and flu medications, can raise blood pressure. These often contain decongestants, which constrict blood vessels. Always read labels and consult your doctor if you have hypertension before taking new medications, even those available without a prescription. Chronic inflammation in the body, often due to autoimmune diseases or ongoing infections, can damage blood vessels and contribute to high blood pressure. Managing underlying conditions and reducing inflammation through a healthy lifestyle can help protect your cardiovascular system. Environmental factors like air pollution, noise, and exposure to toxins can also influence blood pressure. Chronic exposure to these stressors can cause inflammation and stress responses in the body, leading to higher blood pressure over time. Reducing exposure where possible and creating a healthy living environment can help lower your risk. Consuming too much sugar, especially from sugary drinks and processed foods, can contribute to weight gain, insulin resistance, and higher blood pressure. Sugar can also increase inflammation and damage blood vessels. Limiting added sugars in your diet is an important step toward maintaining healthy blood pressure. High cholesterol can lead to the buildup of plaque in your arteries, making them narrower and less flexible. This increases resistance to blood flow and raises your blood pressure. Managing cholesterol through diet, exercise, and medication if needed is crucial for heart and blood vessel health. Long hours at work and high job stress can contribute to chronic stress and, in turn, high blood pressure. Overworking often leads to poor sleep, unhealthy eating, and less time for exercise, all of which are risk factors for hypertension. Balancing work and personal life is important for maintaining healthy blood pressure. Lack of social connections and support can increase stress and negatively impact your mental health, both of which can contribute to high blood pressure. Staying connected with friends, family, or community groups can help buffer stress and support overall well-being. Women going through menopause often experience changes in hormone levels that can affect blood pressure. The drop in estrogen can lead to stiffer blood vessels and higher risk of hypertension. Regular monitoring and healthy lifestyle choices are especially important during this stage of life. Living with chronic pain, such as arthritis or fibromyalgia, can keep your body in a constant state of stress. This ongoing discomfort can lead to persistent elevations in blood pressure. Effective pain management and stress reduction techniques are important for people with chronic pain conditions. Frequent exposure to loud noise, whether at work or in your environment, can trigger stress responses in your body. Over time, this can contribute to higher blood pressure. Using ear protection and seeking quieter environments when possible can help reduce this risk. Certain illegal drugs, such as cocaine and amphetamines, can cause dangerous spikes in blood pressure. These substances put extreme stress on your heart and blood vessels, increasing the risk of heart attack, stroke, and other serious complications. Avoiding these drugs is essential for your cardiovascular health. Strong emotions like anger, fear, or grief can cause temporary surges in blood pressure. While these spikes are usually short-lived, frequent emotional turmoil can contribute to long-term hypertension. Learning healthy ways to process and express emotions can help keep your blood pressure stable. Living or traveling at high altitudes can temporarily raise your blood pressure as your body adjusts to lower oxygen levels. For most people, this effect is mild and temporary, but those with existing hypertension should be cautious and monitor their blood pressure when at high elevations. Blood pressure can fluctuate with the seasons. Cold weather causes blood vessels to narrow, which can raise blood pressure. People with hypertension should be especially mindful during winter months and take extra care to manage their condition. Taking too many vitamin or mineral supplements, especially those containing licorice or certain herbal ingredients, can raise blood pressure. Always discuss supplements with your healthcare provider to ensure they're safe and appropriate for you. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, can raise blood pressure when used regularly. If you need pain relief, talk to your doctor about safer alternatives, especially if you have hypertension. Licorice, found in some candies and herbal remedies, contains a compound that can raise blood pressure by affecting hormone levels. Consuming large amounts or using licorice supplements can be especially risky for people with hypertension. Both overactive and underactive thyroid conditions can impact blood pressure. Hyperthyroidism can cause high blood pressure by increasing heart rate, while hypothyroidism can stiffen arteries. Proper diagnosis and treatment are essential for maintaining healthy blood pressure. Steroid medications, often prescribed for inflammation or autoimmune conditions, can cause fluid retention and raise blood pressure. If you need to take steroids, your doctor will monitor your blood pressure closely and may adjust your treatment as needed. While moderate alcohol use may not have a major impact, chronic heavy drinking can significantly raise blood pressure and damage your heart. Reducing alcohol intake is an important step for anyone looking to control hypertension. Energy drinks often contain high levels of caffeine and other stimulants, which can cause spikes in blood pressure. Regular consumption can be especially risky for people with hypertension or heart conditions. Limiting or avoiding energy drinks is a smart choice for heart health. A diet low in fruits, vegetables, and whole grains, and high in processed foods, can increase your risk for hypertension. These foods often lack important nutrients like potassium and fiber, which help regulate blood pressure. Improving your diet quality is a powerful way to support your cardiovascular health. We've covered a wide range of triggers for high blood pressure, from lifestyle factors like diet, exercise, and stress, to medical conditions and environmental influences. Understanding these triggers empowers you to make informed choices and take control of your health. Remember, small changes can add up to big improvements in your blood pressure and overall well-being. If you recognize any of these triggers in your own life, now is the perfect time to take action. Talk to your healthcare provider about your blood pressure and what steps you can take to lower your risk. With the right knowledge and support, you can manage hypertension and enjoy a healthier, more vibrant life. Thank you for watching, and take care of your heart.